Dr. Freud did a lot of good theories about the mental health situation and did a lot of good things, but at the point of healing has been proved afterwards that things do not work this way. For example, in my clinical practice, I have received a patient that says, well, I have problems, I have a sexual dysfunction, I don't get orgasm with my husband, and I love him, I like him, and I know why. And then you ask why? I said, well, because I was raped when I was 8 years old. My father-in-law raped me, and every time that I go to do sex with my husband, come to my conscious the flashback of this situation so traumatic that I cannot relax and I cannot concentrate myself, and as a consequence of this, I don't get any orgasm. So here is the example. So the patient knows exactly the origin and the cause of the problem, but the patient is not healed. The patient is asking help. And there are many other conditions, for example, phobia, claustrophobia. Come the patient and say, well, I cannot be really comfortable. I get like a panic attack when I get into a room, a 10 by 10 feet room. There is no reason why, but I know why. You ask, well, tell me why. Well, because when I was a child, my father used to punish me, enclosing me in a closet and lock it, and I was really terrified because it was dark and I was a child. And starting in this point, I cannot be inside any small room or elevator or something like that. So again, in this second example, the patient realizes the cause and remembers exactly the problem, and still the patient is asking help. In those two cases, shows that even though you can be a very intelligent person, you can even realize the cause of the problem, using the willpower or appealing to the willpower of this person is not enough to heal the problem. So you can tell the patient, well, if you know that it was the origin of the problem, why you don't go over this problem and solve this problem? The patient declares, well, I know what was the problem, but I really cannot solve it. I am here asking for help. And what is the secret? The secret is that the brain is like a fruit, let's say like an apple. The apple has a red skin and has a white mass under this skin. This red skin is like the memory, the conscious memory, the cortical memory of the brain. As a matter of fact, the cortical memory is 2 or 3 millimeters only in the brain. And the rest of the mass of the brain under this cortical level is what we name subcortical memory or subconscious memory. Once the information, the bad information, the relationship, sex anxiety, or the relationship fears, claustrophobia, to close places, is storage at subcortical level, there is nothing the patient can do using this small cortical memory where the willpower and the intelligence and the logic reasoning work, is nothing he can do to erase this bad information. You have to hypnotize the person or inhibit the cortical memory to open a door and to get into the subcortical memory through the ears of the patient that is going to be listening to you all the time when he's in trance or she's in trance, and then record or program healthy information on top of this bad information that was there, and then the person get healed. Exactly to change any type of habits or connections or links or association like coffee, smoking, worries, smoking, I cannot sleep if I don't smoke, I cannot make sex if I don't smoke. any type of conditioning. They don't have to be logic at all, are going to function, are going to have effect, no matter how hard you try voluntarily to change this condition. The memory at subcortical level determines the behavior. That is very important to understand, because the intelligence of the person operates at cortical level. And many people ask me, how so many people that are brilliant, that are intelligent, they are good engineers, they are good doctors, they are successful professionally, and they are, some of them, rich. How is possible that this person is going to be smoking 2 packages of cigarettes a day, that he knows exactly that is going to live 15 years less, that he knows exactly what risk is taken? And this shows that intelligence, rational logic, has nothing to do with pathology, and the person can be a genius, can be brilliant at cortical level where the intelligence operates, and is doing simple, stupid things like smoking or addiction to drugs, street drugs, or addiction to medications, or any type of illogical, absurd behavior that has nothing to do with the intelligence of this subject. That explains that. It's very important, because a lot of people ask themselves this question. And some mothers, for example, say, my child is brilliant, my child is very intelligent, but he's sick, he's hyperactive, he's a lot of anxiety, he doesn't stop. So how can be that possible? A child so smart, so intelligent, with this type of abnormal behavior. So I'm explaining to you the difference. The abnormal behavior resides at the basement, subcortical level of the mental building, and the intelligence operates at the roof. When you go to traditional consultation with a psychotherapist, psychiatrist, or psychology who does not practice hypnosis, he is appealing to your willpower, to your logical reasoning, to provoke a change in your pathological behavior. And they are wasting their time. That's why patients declare that they have been 2, 3, 4, 5 times in one psychologist and they stay the same, or they have been for many, many years in a psychiatrist receiving medication, prescribed medication, and they stay basically the same. Or the condition going worse, because they started with 1 milligram, and then 3 milligrams, and then 5, and then 10, and people are really addicted to medication because the real problem was subcortical memory.